Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And as a practicing chiropractor for 23 years, this particular study really hits close to home and illustrates part of why picking the right provider can make a huge difference in whether or not you develop chronic pain or not. I've always said that the reason we have so much chronic pain is the mismanagement of the acute scenario in the first place. Things like over-icing, limiting activity, taking anti-inflammatories, all of these things have been shown to definitely affect healing. And if we don't fix something right in the first place, it's more likely to go chronic. Well, when it comes to low back pain, there's a lot of factors that play a role. And any good provider that deals with back pain from an evidence standpoint should recognize these and be able to do their best to address these and make sure that that acute patient whose low back pain just developed never becomes a chronic patient. And so we're going to go over some of those factors. Some of these factors you can change. Some of these factors, um, you can't change immediately, and other ones have to do with the provider and how a provider manages your case. So this looked at 5,200, so 5,233 people who developed acute low back pain. And they followed up for 6 months later to see what factors played a role in these people developing chronic low back pain. And it used to be that our thought was, oh, well, acute back pain, it all goes away on its own. And we found that that's really not often the case. It is for a good chunk of them, but there's a good chunk of people with acute low back pain that develop into chronic back pain, and that's where all the problems, and that's the most expensive element in healthcare, believe it or not, sheerly because of its volume. Non-surgical spinal care is an insurance company's most expensive line item. So anything we can do to manage that and keep people from falling into the chronic stage is always a good thing. And this particular study looked at a couple different things in what characteristic traits were more likely to progress somebody to become chronic. Obesity, people with obesity were 52% more likely to become, for that acute low back pain to become chronic. Well, that makes sense. You're driving more inflammation. A lot of times there's inactivity that plays a role in the obesity. So, and not only that, but the spine carrying extra weight. Smoking, 56% more likely. You're reducing blood flow to tissues that are trying to heal. People, depression or anxiety, 66% more likely to progress to chronic low back pain. And somebody who had a severe disability, that was 82% more likely. So this isn't disability from low back pain, it's from something else, and you're now tagging on chronic low back pain on top of it. But another factor that people looked at was a score. It has to do with your mindset when it comes to low back pain. And a good measure for this is a 9-question survey called the Keel Start Back Screening Tool. I've been aware of this for a long time. I don't use the screening tool, but I'm aware of what goes into it. And without using the screening tool, you can get a good idea of what a patient's mindset is when it comes to their pain. And the less control somebody has over, or the less control that a patient believes they have over pain, the more likely that pain is to get away from them and become chronic. So I'll actually post this questionnaire in a link to the questionnaire in the description. But it all has to do with how in control you feel of your low back pain. If you feel like back pain is out of control and there's nothing you're going to ever be able to do to control it, your numbers on this screening tool goes up. And so people who are in the high risk category of this screen, this 9 questions, they were 245% more likely to progress to chronic. So we're talking about things that mindset that you can change. Nothing to do with anything else but your mindset when it deals with that. And I will tell you time and time and time again in my practice, I am talking people off a ledge and explaining to them that this episode of back pain doesn't have to become anything. And just a minimal level of care can provide a good outcome, and it's less likely to become chronic. That means that providers that sell large packages may be setting you up for believing that this is a more encompassing problem that's going to take more action to cure. Long treatment plans and kind of scaring you into care, that's always something that you should run from. We usually go the opposite direction, that the goal is to try to get somebody as better as fast as possible and reassure them that this is going to need very little care. We're just going to shove it in the right direction, and them moving is going to be the best outcome for somebody. The other thing that this study looked at was what's called non-concordant guidelines. So there are guidelines that we know that are bad for low back pain. They looked at 3 particular guidelines. One was pharmacological management. So were opioids used, were benzodiazepine used, were steroids used, and how they played a role. Obviously, as a chiropractor, if somebody's seeing me, like, that one is not even on the list because we're not going to have a discussion with that. The second, but if somebody was mismanaged with that, they were given a score of 1. Or they had 1 concordant, non-concordant. The other thing is imaging. We've covered this before, that early imaging can be a bad thing because it puts something in your mindset. And the third has to do with specialty referral. If you go see your primary care doctor and he immediately refers you to an orthopedic doc or a pain management doc or something along those lines, that is considered non-concordant care. So if somebody had one of these factors, they were 39% more likely to progress to chronic care. If they had 2, they were 88%. And if all 3 of these happened in your provider's office, 216% more likely to progress to chronic low back pain. So the big picture, 2 things that are absolutely under control is A, your mindset when it comes to that acute low back pain and how much control you feel over it, and 2, how your provider manages your care. Obviously, as a chiropractor, in the data supports that chiropractors have a much higher tendency to treat people within the guidelines. Well, of course, A, we can't do any of the prescriptions, so we don't have to worry about that there. But very conservative with imaging and not referring to specialists until it is needed and somebody hasn't responded to care. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.